friends, today we will discuss paper 2nd of UPSC CMS 2021, and I have already covered paper 1 of 2021 in my previous video, so you can also watch those videos also. And I will also cover all the papers from 2018 to 2023. So let's start with the first question today. Which of the following are the types of wound healing? So we know that wound healing can be primary type and secondary and tertiary, but there is no quaternary. So answer here will be 1, 2 and 3. There is no quaternary intention. There is primary intention in which we will close the wound and the normal healing will occur. In secondary intention, we will left the wound open and healing will be occur by the granulation tissue. And in tertiary, we will initially left the wound open. After that, we will close the wound later on. So answer here will be 1, 2 and 3. Option A is correct. Second question. A 50-year-old female present to the emergency with the pain, swelling and redness over the left foot following a trivial trauma 3 days back. On examination, the swelling over the left foot is poorly localized. Local tenderness and erythema are present and the crepitus is absent. Distal pulsations are palpable. The most likely clinical diagnosis here will be, so here the history of trauma is given and it is a poorly localized and local tenderness is also present and no crepitus is there. So when the crepitus is not present, then we have to go for the cellulitis, because if we talk about the fasciitis, then the crepitus is present in the fasciitis. In abscess, pus collection is present, and in compartment syndrome, absence of pulses are there is a absence of the distal pulses, but here the distal pulsations are palpable. So answer cannot be compartment syndrome, answer cannot be abscess, and answer cannot be fasciitis. So here the answer will be cellulitis. Which of the following is not associated with BRCA1 and the BRCA2 genes? So we know that the BRCA1 or BRCA2 genes are related to mainly breast cancer. After that, they are also related to the ovarian cancer, prostate cancer, pancreas cancer, melanoma, etc. But they are not related to the liver cancer. So answer here will be liver. Answer D will be. A malignancy associated with Stewart-Trevis syndrome is. So Stewart-Trevis syndrome generally occur after the mastectomy. Whenever there is operation mastectomy is there, then after that lymphedema can occur, and when the lymphedema become chronic and it will convert into the lymphangiosarcoma, then it is called as the Stewart-Trevis syndrome. So answer here will be lymphangiosarcoma. A 60-year-old lady underwent total abdominal hysterectomy. On the third post-operative day, she suddenly became breathless while returning from the washroom. Her blood pressure recorded was 80 by 50 of mercury, and the most probable diagnosis is. So there is a history of abdominal hysterectomy, and on the third day breathlessness is there, sudden breathlessness is there. So it is a case of thromboembolism which occur generally after any surgery. So answer here will be thromboembolism. A 52-year-old female underwent MRM. After few years, she developed lymphedema of the ipsilateral arm. Which of the following malignancy can develop? We have already seen in the previous question. The question is again repeated. It is lymphangiosarcoma. It is a Stewart-Trevis syndrome in which after mastectomy lymphedema occur, and when lymphedema become chronic, then it may change into the lymphangiosarcoma. So answer here is option A. A gentleman of 60-year-old present with the brownish swelling of the submandibular region. So whenever there is swelling of the submandibular region, there are only few differential diagnoses, and when it is given it is a brownish swelling, then we can directly say that it is a Ludwig angina. And then also in the question, with inflammatory edema of the mouth with putrid halitosis. So all these are the feature of the Ludwig angina. Whenever brownish swelling of the submandibular region is given, then we can directly go for the Ludwig angina. and it is a streptococcal infection, or it may be associated with the anaerobic organism also. A 52-year-old female patient with previous history of the neck irradiation present with the thyroid swelling for last 6 months. The patient is clinically euthyroid. On examination, the right lobe of the thyroid is enlarged with the presence of ipsilateral cervical lymphadenopathy. The most clinical diagnosis is, so there are some catch points in the question that after the neck irradiation, so after uh, irradiation, most common thyroid tumor which occur is the papillary thyroid cancer. Then the female is given, young female is given. So in young female, the most common thyroid cancer is the papillary. Then after that, ipsilateral cervical lymphadenopathy. It means that the cancer is spreading by the lymphatic route. So this is also most common in the papillary thyroid. So answer here will be papillary thyroid cancer. An infant present in the surgical OPD with the complaint of the unilateral swelling of the neck. So there is a unilateral swelling of the neck. The swelling was soft, cystic, and partially compressible with the brilliant transilluminance. So here the patient is infant. So any infant with the unilateral swelling which is brilliantly transilluminate, so we can directly go for the diagnosis of the cystic hygroma, because in the cystic hygroma only there is a clear fluid, so there will be brilliant transilluminescence, and also the swelling is soft and cystic. So it generally present in the infant because it occurs by birth. So answer here will be cystic hygroma. Serum thyroid level is an important tumor marker for. So here also the answer will be papillary thyroid, because if we talk about the serum thyroglobulin level, then they generally occur in the increase in the papillary thyroid cancer, Hurthle cell carcinoma, and follicular carcinoma. So among these, only papillary thyroid cancer is given in the option. So answer here will be option B. A 43 years old woman present with the serious discharge from the single duct of the nipple of her right breast, which was sent for the evaluation. She is unlikely to be suffering from. So, answer options are fibrocystic disease, no. In fibrocystic disease, there are no discharge, and in interductal papilloma, yes, it is a it is one of the common cause of the serious discharge from the. It is one of the common cause of the discharge from the breast. Ductectasia also, a greenish discharge is present, and in carcinoma bloody discharge is present. So here the answer will be fibrocystic disease, option A, because in fibrocystic disease generally there is no discharge from the breast or the nipples. Eight-month-old male child is brought to the emergency with recurrent episodes of screaming and drawing of the legs. The child appears to be listless in between the attacks. Local examination of the abdomen reveals the feeling of emptiness in the right iliac fossa. Whenever there is a feeling of the right emptiness, then generally it is associated with the intussusception, because one part of the bowel move into the another part. So the part which move into the another part, the place of that part will be empty. And also there is a blood stained mucus. So we know that in the intussusception there is a recurrent jelly stools. So all the features are supporting the diagnosis of the acute intussusception, and it is a painful condition. So it is also given that the child is screaming. Which of the following regard Ogilvy syndromes are correct? So we know that in the Ogilvy syndrome there is no mechanical obstruction. So let's see the option. It present with the acute large bowel mechanical obstruction. No, there is no mechanical obstruction. Marked cecal dilation is common feature of the X-ray abdomen. Yes, this is true. Cecal perforation is a well recognized complication. Yes, this is also true because there is a obstruction, pseudo obstruction is present, but it may lead to the cecal perforation in the chronic condition. Intravenous neostigmine is used for the treatment of this condition. This is also true. If it is not treated by the neostigmine, then we have to do the colonoscopic decompression. So answer here is 2, 3 and 4. So option B is correct. Which of the following regarding the carcinoid tumors are correct? So we know that the carcinoid most common in the appendix, then second most common site is the ileum, and the third most common site is the rectum. So let's see the option. Terminal ileum is the most common site. No, this option is incorrect because most common site is the appendix. These tumors arise from the Kolchitsky cells situated on the base of the intestinal crypts. This is true. 5-hydrotryptamine is the most common vasoactive peptides produced by these tumors. This is also true. And serum chromogranin A is a powerful marker. This is also a useful marker. This is also true. So answer here will be option B, which is 2, 3 and 4 are correct. Option 1 is incorrect because the most common site is the appendix, not the terminal ileum. In familial adenomatous polyposis, which of the following are true? Presence of greater than 100 colorectal polyps. Yes, this is true. Positive family history. Yes, this is true. It is written in the name only. And autosomal recessive. No, this is not true because it is a autosomal dominant condition. So answer here, this is the wrong option. And genetic mutation of the chromosome 5. Yes, this is true because it is related to chromosome 5 in which the APC gene is present. So answer here will be 1, 2 and 4 are correct. So option B will be the answer. A 50-year-old male patient present to the emergency with the sudden onset of upper abdominal pain, nausea, vomiting and hematemesis. On examination, pulse rate is 106 per minute, BP is 100/70 and pallor is present. CCT abdomen reveals the large exophytic tumor of the size 13:8 centimeter at the fundus of the stomach. On upper GI endoscopy, the mucosal overlying the tumor is intact. The staining for CD117 in the upper GI endoscopic biopsy is present. So after seeing this only we can make the diagnosis because CD117 is present positive in the gastrointestinal stromal tumor, which are also known as the GIST. So answer here will be the gastrointestinal stromal tumor because CD117 is positive. Also CD34 is positive and the most specific is DOG1, which is positive. And it is just are the mesenchymal tumor, not the epithelial tumors, and they arise from the interstitial cells of Cajal, and the most common site for them is stomach. After that, the second most common site is the intestine. Which of the following is not a classical symptoms of acute appendicitis? So anorexia is present, periumbilical colic is present, constipation, no, constipation is generally not there, and nausea. So anorexia, periumbilical colic, nausea, these all are the signs of the acute appendicitis but not the constipation. So answer here will be C, constipation. So we know that the acute appendicitis symptoms are periumbilical colic, pain shift to the right iliac fossa, anorexia is there, nausea is there and vomiting is there. So these are the common feature of the appendicitis. Among the extraintestinal manifestation of the Crohn's disease, which of the following are related to the disease activity? So we have to remember, or we have to learn that those which are the complications which are related to the disease activity are those which are the eye complications such as the iritis and uveitis, and arthropathy, aphthous ulceration, amyloidosis, pyoderma gangrenosum and erythema nodosum. Rest all are not related to the disease activity. So answer here will be the eye complications. A 35-year-old male patient with the enteric fever present with the emergency with the sudden onset of the generalized abdominal pain, abdominal distension, nausea, vomiting and constipation for the last 48 hours. On examination, the patient is dehydrated with PR of 110 and the BP is 100/60. There is no generalized tenderness, rebound tenderness and board-like rigidity on per abdomen examination. The most likely complication of the enteric fever is the so they have given the long history, but they have lastly add something other. Uh, so the most likely complication of enteric fever, we know that in enteric fever there is generally longitudinal ulcers are there and they have the tendency to perforate in the chronic cases. So small bowel perforation will be there. So answer B, option B is the answer. Which of the following options for management of pancreatic pseudocyst? So whenever there is a pseudocyst, we have to either drain it or we have to connect it with the other organs such as the stomach. So here we can do the endoscopic drainage or percutaneous drainage, and we can connect it with the stomach by the cystogastrostommy. But there is no operation pancreatic duodenectomy which is related to the pancreatic pseudocyst. So answer here will be 2, 3 and 4. Only two options are there, that we can either do the drainage or we can either connect it with the stomach, or also we can connect it with the jejunum. So cystojejunostomy can also be done. So answer here will be the option D. Which of the following statement regarding the hepatic adenomas are correct? The most they are the most exclusively seen in female age 25 to 50 years. Yes, this is true because hepatic adenoma are generally related to the younger ages. They are associated with the use of the oral contraceptive pills. This is also true. They do not have any malignant potential. No, this is not true because hepatic adenomas have 10% risk of getting converted into the malignancy. So this is the wrong option. Majority are detected incidentally on imaging. This is also true. So because option C is incorrect, so answer will be 1, 2 and 4. Option D is correct. Which of the following are the probable site for the ectopic pancreas? So if we talk about the ectopic pancreatic tissue, then the sites can be stomach, duodenum, liver and splenic hilum. But small bowel mesentery are not the common site for the ectopic pancreas. So we have to remember. And other also other organ where the ectopic pancreas can be found are the gallbladder and the distal one third of the esophagus. So answer here will be 1, 2 and 4. Which of the following statement regarding the Kentley's line is correct? So Kentley's line, we know that it runs between the gallbladder and the middle hepatic vein. So it will divide the liver into the functional right and the left part. So answer C is correct because it is a line which runs between the gallbladder fossa and the middle hepatic vein. So it starts from the gallbladder fossa and the middle hepatic vein, then it will divide the liver into the left half and the right half. So answer here will be C. Which of the following are the indication of the splenectomy? So splenectomy is done in the case of the trauma, in the case of the ITP and hypersplenism, but it is not done in the case of the pseudomyxoma peritoni. So answer here will be 2, 3 and 4. And we have to also remember that autosplenectomy occur in the case of the sickle cell anemia. And whenever we have to do the splenectomy, then we have to also give the prophylaxis of vaccination of capsulated organism such as the pneumococcus, streptococcus, etc. So answer here is D. Which a 45-year-old female patient present with the painless firm abdominal swelling of size 10 into 8 cm near the umbilicus. So the swelling is present near the umbilicus and the swelling will can be moved freely in the plane at the right angle to the line of the attachment. So whenever we see this line that the swelling is there and it is moving at the right angle or perpendicular, then we have to directly make the diagnosis as the mesenteric cyst, because this is the Tilloch sign and it is seen in the mesenteric cyst. So answer here will be mesenteric cyst, C option. A 45-year-old patient, a known case of the left inguinal hernia, present to the emergency with the acute onset of the pain abdomen associated with the nausea, vomiting and abdominal distension. His pulse rate are 102 per minute and BP is 100 by 70 and respiratory rate is 24 per minute. On local examination, the skin overlying the swelling is tense and erythematous. Okay, there is localized tenderness over the swelling and the swelling is irreducible and with the absence of the cuff impulse. So it is a case of the inguinal hernia, and in which we know that there is no uh, irreducibility is absent, and also there is the absence of the cuff impulse, and the swelling is tense and erythematous. So these all are the features of the strangulated hernia, because strangulated hernia occurs as a complication of the normal hernia on the chronic obstruction, and here irritability is there, decreased blood supply is there, and fever, pain and decreased BP is also there. So answer will be strangulated hernia. Mayo's repair is done in the case of, this is a direct question, it is done in the case of the umbilical hernia. So we can remember by Mayu or Mayu, and it is for the umbilical hernia. In Pringles maneuver, clamping includes which of the following? So we have to remember it by the DAV. D for the duct, A for artery, and V for vein. So one duct is there, which is the which is the bile duct, and one artery is there, which is the hepatic artery, and one vein, which is the portal vein. So answer here will be 1, 2 and 3. Option A is correct. A patient with the suspected head injury is brought to the emergency following the road traffic accident. At the time of the examination, the patient is conscious with Glasgow coma score 14 by 15 and stable vitals are there. There is bleeding from the right ear and the CSF leak from the nose. Bruising is present behind the right ear. Whenever there is a head injury and bruising is present behind the right ear, then we have to directly make the diagnosis of the Battle sign. So when there is a bruising behind the right ear, it is a Battle sign, and it is generally related to the fracture of the base of the skull. The commonest organism causing the suppurative otitis media is, this is a direct question. For suppurative otitis media, most common organism is Streptococcus pneumoniae. A patient of road traffic accident present to the emergency with the increasing restlessness and difficulty in breathing. The respiratory rate is 26 breaths per minute. There is distended neck veins. Trachea is deviated to the right side and hyperresonant. So these all are the feature we can see are of the pneumothorax, because there is a hyperresonant note on the percussion and the trachea is shifting to the opposite side, and also there is the distension of the neck veins. So hence the diagnosis is pneumothorax. Now what we have to do in the case of the pneumothorax, that we have to the most probable the options are the most probable clinical diagnosis left tension pneumothorax, this is true. Immediate chest decompression using the wide bore cannula in left second intercostal space should be done, this is also true. Immediate chest x-ray should be done to confirm the diagnosis. No, the diagnosis is already made on the basis of the clinical symptoms, so there is no further diagnosis further requirement of doing the chest x-ray at that time. And definitive chest tube insertion in the left fifth intercostal space should be done, this is also true. So we have to mainly manage the patient because it is a emergency condition, so we do not have to waste the time. So answer here will be 1, 2 and 4. Option third is incorrect. The PET scan is used in pre-operative staging of gastroesophageal tumors is used to detect. So it is used generally to detect the distant metastatic disease. So where it is generally used for finding where the tumor has spreaded. So our answer will be option A, distant metastatic disease. For local spread and the lymph node status and the extension into the stomach, we can also find it on the CT scan. So for PET scan, metastatic disease can be found. Which of the following are correct about the ectopic ureters? So there are more common in males. No, ectopic ureter are more common in female, and the ratio of the incidence of the ectopic ureter in male to female to male is 7:1. They drain the upper pole. This is true because whenever the ectopic ureter is present, then they generally drain the upper pole. They are associated with the duplex ureter. Yes, this is also true, and they may cause the incontinence. Yes, whenever the ectopic ureter opens after the external sphincter, then it will lead to the incontinence. So answer here will be 2, 3 and 4. Answer will be option D. Which of the following is a nephrotoxic anesthetic agent? So anesthetic agent, we know that all these are the nephrotoxic, but among these the most nephrotoxic is the methoxyflurane, which is not used nowadays. So we can use the halothane isoflurane because they are less nephrotoxic than the methoxyflurane. So answer here will be option A. A comatose patient after sustaining severe head injury has been admitted in the neurosurgical ICU. Which of the following parameters should ideally be maintained in the patient? So, PCO2 should be maintained between 4.5 to 5 kilopascal. Yes, this is true. Mean arterial pressure should also be maintained between 80 to 90, and PO2 should be maintained greater than 11 kilopascal. This is true, but sodium less than 130. No, sodium should be more than 140 for the being in the normal range. So answer will be 1, 2 and 3, and option 4 is incorrect. It should be greater than 130, or specifically it should be greater than 140. So answer will be 1, 2 and 3. So untidy wounds are characterized by which of the following? So crushed and the avulsion tissue are there, avulsed tissue, contaminated wound will be there, and devitalized tissue will be there. But there is no loss of tissue. This is incorrect because in the untidy wounds, generally the loss of tissue is also present because there is a crushing of the avulsion of the tissue. So answer will be 1, 2 and 3. Option A is correct. Which of the following statement regarding the composition of the common crystalloid solution is correct? So if we talk about the common crystalloid solution, then it is these are the NaCl, ringal lactate, or the Hartmann solution. So if we talk about the normal saline, then normal saline contain 100 milliequivalent per liter of the sodium. No, this is incorrect because it contains 154 milliequivalent of sodium. So Hartmann solution contain 111 milliequivalent of the chlorine. This is true. Normal saline contain 130, no, 144 we have already seen, and in Hartmann solution contain 111 of the sodium. No, this is 131. So here the answer will be Hartmann solution containing the 111 milliequivalent per liter of the chlorine. This is true. Perioperative benefits from transfusion is with the hemoglobin level of. So we generally do transfusion whenever there is a very severe type of the anemia or very severe type of the blood loss. So when the hemoglobin is less than 6, then it will be beneficial to give the transfusion, and if it is more than this, then we can give the iron folic acid treatment if there is no emergency. Ideal weight gain during the pregnancy from for a woman with normal BMI should be. It is generally about 11 to 12 kg. So answer here will be between 11 to 16 kg. Option B is correct. Blood volume increase during pregnancy above non-pregnant level at 30 to 34 weeks. Blood volume increase during pregnancy above non-pregnant level at 30 to 34 weeks by 10 to 20%. No, by 25 to 30%. No, it is about 50%, because at that time it is a maximum requirement. It is a maximum requirement for this blood for the growth of the fetus. So answer here will be 40 to 50% between 30 to 34 weeks. Which of the following are the contraindication to the extracephalic version in the antenatal management of the breech presentation? So what are the contraindication to external cephalic version in the antenatal management of the breech presentation? So whenever there is a antepartum hemorrhage, then we do not have to do the external cephalic version. In the multiple pregnancy also we don't do this, and in severe oligohydramnios we also don't do this. So, and reactive non-stress test, no, this is incorrect, because reactive non-stress test is the favorable condition. So here we can do the ECV, but in all other cases these are the favorable conditions, so ECV is contraindicated. So answer will be 1, 2 and 4. Option B is correct. Antepartum hemorrhage is defined as the bleeding from genital tract. So it is generally the bleeding which occur after the period of viability, which in India is 28 weeks. So after 28 weeks of the pregnancy or the period of viability, the antepartum hemorrhage is defined as the bleeding from the genital tract. Which of the following is not a risk factor for the preeclampsia? So primary gravida is the known risk factor for the preeclampsia. Obesity and pre-existing any vascular disease is also a risk factor, but placenta previa is not a risk factor. Also the placenta previa is the complication of the preeclampsia. Placenta previa is the complication of preeclampsia, but not a risk factor. What are the Spiegelberg criteria for the diagnosis of ovarian pregnancy? So tube on the affected side must be intact. This is true. Gestational sac must be in the position of ovary. This is also true. Gestational sac is connected to the uterus by ovarian ligament. This is also true. And ovarian tissue must be detected on the wall of the histological examination. This is also true. So all the options are correct here. So answer will be 1, 2, 3, 4, option C. Which of the following statement is regarding the fetal well-being is not correct? Daily fetal movement is simple reliable method of fetal well-being. Yes, this is true. Modified biophysical profile include non-stress test and the fetal breathing. No, it include NST and the AFI. AFI is the amniotic fluid index. And mother perceive 88% of the fetal movement. Yes, this is also favorable. And healthy fetus should have minimum 10 movements in 12 hour of the period. So this is also true. So here the incorrect option is option B, because in the MBP or the modified biophysical profile, so NST and AFI are there, not the breathing. Which of the following statements are incorrect with respect to the antenatal USG examination? In health, it help in detecting the gross fetal anomalies. Yes, this is true. It help in identifying the multiple pregnancy. This is also true. It help in identifying the viable pregnancy. This is also true. Best dating is possible with the third trimester. Ultrasonography is used for the dating in the first trimester, not in the third trimester. So this is the incorrect option. So answer here will be 1, 2 and 3. Option D is correct. During pregnancy, iron supplementation is needed for. So we know that the iron supplementation should be given to all the female, whether they have anemia or not, and it should be started after the first trimester. So all the pregnant mothers require the iron supplementation, and it should be started from the 16 week onwards. So answer will be option A. The clinical feature of physiological edema in the pregnancy is it present on the both lower limbs and abdomen. No, this is not true because it generally occur in the one leg and generally it occur in the right leg. It associated with the cardiac or the renal pathology. No, this is a physiological, not pathological, and it is usually of moderate or the severe grade. No, generally it is of a mild grade. Disappear on markedly reduced on the rest. Yes, this is true because it is a physiological and the mild type of the edema, and generally it can be relieved after the rest. The normal rate of dilation of the cervix in the primary gravida is, so if it is talk about the normal rate of the dilation in the primary gravida, then it is 1 centimeter per hour, and in multigravida it is 1.5 centimeter per hour, but it can be more than 1 centimeter hour per hour. So it is a average dilation of the cervix, that is 1 centimeter per hour. In a mechanism of normal labor, the engaging transverse diameter is, so it here it is asked about the transverse diameter. So the transverse diameter generally is biparietal diameter, and whenever it is talked about the AP diameter, then AP diameter will be occipito-brachmatic diameter in the normal labor. So normal labor is the generally vertex presentation, and occiput is in lateral position. So here the and it is completely flexed position. So here the AP diameter is suboccipito-brachmatic, and if it is asked about the transverse diameter, then it is a biparietal diameter. Compared to the breast milk, colostrum has, we know that colostrum is generally the milk which come in the starting 3 to 4 days, and it is a thick milk, yellow color, and it generally have the antibodies or the immunity factors and the proteins. So it has less fats and the sugar. So higher colostrum compared to the breast milk, colostrum has higher protein content. This is true because it has high protein, high IgA, high sodium, high chlorine, and less of the potassium, less of sugar, and less fats. In non-lactating mother, after delivery ovulation occur in, if the mother is non-lactating, then the ovulation will occur after 1 month, which is about 4 weeks. And if the mother is lactating, then generally so the ovulation do not occur till the 6 months, but it can occur sometime after 1.5 to 2 months also in a lactating, but in non-lactating it can occur as early as 4 weeks. Which of the following are the prerequisite for the outlet forceps delivery? So bladder should be empty. This is true. Membrane should be intact. No, membrane should be ruptured. So this is false statement. Cervix should be fully dilated. This is true. And fetal skull has reached the level of the pelvic outlet. Yes, then only we have to do the outlet forceps delivery. So answer here will be 1, 2, 1, 3 and 4. Option C is correct. The vaginal pH in childbearing age normally range between. So vaginal pH in the childbearing age is generally acidic, and it range between the 4 to 5.5 pH. It occurs due to the estrogen activate the dorsal bacilli, which will convert the glycogen into the lactic acid, due to which so acidic environment is there. The Gardner duct cyst is usually located in, this is a direct question, it is the anterolateral wall of the vagina, and if it is about the Bartholin cyst, then it is in the posterior lateral wall of the vagina, and it is associated with the labia majora. So for G we have to remember A, and for B we have to remember P. So G, A and BP. For Bartholin posterolateral, and for Gardner's anterolateral. Endometrial sampling for diagnosis of the ovulation is done on which day of the menstrual cycle? So it is generally done after the ovulation only, because we have to diagnose of the ovulation, so we cannot do it before 14 days. So not done before 14 days, it is done after the 14 days. So here the option will be 21st to 23rd day. Here the progesterone is highest. Primary dysmenorrhea can be treated by which of the following? So yes, if it is asked about the primary, so there is no pathology behind it, and these are generally a cyclic pains which occur at the end of the menstrual cycle. So we can give the antiprostaglandins to decrease the pain or the inflammation. Cyclic combined estrogen and progesterone preparation can be given. This is also true. Pre-sacral neurectomy can be done if the condition is chronic or the pain is very much and do not relieve by the antiprostaglandin and the combined oral contraceptive pills. And uterine curettage, no, we do not have to do the uterine curettage, because uterine curettage will lead to the damage to the uterine, and it will also lead further to the formation of the adhesions. So we do not have to prefer this treatment. We can give 1, 2 and 3, but option 4 is incorrect. So answer here will be 1, 2 and 3, option A. Which of the following is correct regarding the obesity and infertility? So if it is asked about the obesity and the infertility, then it is associated with the hypogonadism and hypogonadotropic hypogonadism, which is a PCOD. So we know that obesity and infertility both are present in the PCOD, and generally they are related to the hypogonadotropic hypogonadism. So answer here will be A. Hypergonadotropic hypergonadism, no. There is no change in the HPO axis, wrong. There is change in the HPO axis, due to which there is infertility. It is always associated with endometrial atrophy, no. So we have covered 60 questions of the paper second of the UPSC CMS 2001 in this video, and next 60 questions we will discuss in another video. So thank you for today. Thank you.